Good evening. Welcome to Democratic Television, the place where democratic issues are discussed. It's television by Democrats for Democrats. My name is LaKenya Middlebrook, and I'm delighted to be your host this evening. And we have a very special guest with us today. We are joined by Gloria Johnson. Hi, Gloria.
Hi.
And Gloria is a candidate for State House of Representatives,
right.
District 13.
Correct.
So first of all, we want to thank you for committing yourself to service and stepping out to run. I'm very excited, and it's been a long election cycle, I'm sure, but we're getting down close to the end now. Tell us a little bit about how the race is going.
Everything is going great. You know, there's so much enthusiasm this cycle, and that's exciting for a midterm because a lot of times it's difficult getting people really excited about a midterm. So the fact that there are so many folks out there that really care, really plan on voting this election, really willing to have great conversations. Right. And so where we see a lot of stagnation in D.C., you know, here in Tennessee and especially in Knoxville, we can have good conversations on the doorstep about what people care about.
That's awesome. And now I know that you have had the opportunity to run before.
Yes.
And you know, we say at every election cycle that there's something different about this cycle, but I mean, I think there really kind of is something different
no
about
doubt.
this cycle.
Yeah.
What are you feeling out there? What is kind of different about this time?
Well, you know, like I said, during a midterm, to have this much excitement, and there's just a lot of excitement. But one of the things that's great for us, because a lot of times Democrats feel like there's not a lot of focus on the state of Tennessee.
Right.
And because we've got a great race at the Senate and a great candidate for governor, you know, there's just a lot happening. And there are all these groups in Tennessee, new groups that have started up since 16, like Let America Vote and Indivisible and things like that. And they're grassroots groups and they're boots on the ground, so they're out knocking doors too. It's just really exciting to see all the energy and all the excitement about the upcoming election.
And elections they're long, they're hard, they're tiring, it's
yes,
exhausting. So what kind of motivated you to decide to run this cycle?
Well, you know, because when I was in the House in 13 and 14, a lot of the issues that we were really fighting for, still nothing's been done on them. We still haven't expanded Medicaid in Tennessee, probably the biggest mistake in Tennessee's modern history. Yeah. And, you know, we have got to do that. Overwhelmingly, more than 60% support, regardless of party, in Tennessee for expanding Medicaid. Yeah. And we've just got to do it. Last night I was at an event and a friend said, "Oh, Gloria, you've got to meet Amanda." And Amanda came up to me and she had a scarf on her head, so I sort of assumed maybe there was some sort of cancer or something like that. And she just told me how wonderful it was that the ACA was in existence, because she signed up last year when the signups were, and 3 months later, she was diagnosed with breast cancer.
Wow.
And she said, you know, now, sure, we have to pay the out-of-pocket max, but 2 surgeries, chemo, and radiation, and they're not going to be bankrupt.
Wow.
You know, it's saved their family.
Yeah.
And so just to hear those kind of stories every day, that's what keeps me going. Yeah. You know, to talk to my friends who are teachers and hear how incredibly important it is that we don't privatize our public schools.
Yes.
And we stop with these tests that don't benefit our kids and don't benefit our schools, and make sure that when we're testing kids, we're doing it for all the right reasons, and it actually benefits their instruction and benefits the instruction process for the school, for the teacher, and for the kid.
Wow. Yeah. You know, and those issues are so prominent in our community, and I kind of want to go back a little bit to that healthcare issue, because it is something that seems very obvious. You know, you know, healthcare it's in my mind a right.
Yes.
You know, people have a right to be healthy, or to have access to health care that can improve their quality of life. If we have a healthy community, we have a healthy workforce that can improve our economy. And so, you know, to see, like you said, that we've had this huge moral failure in our state for, you know, several years now of not expanding Medicaid. What do you see as being different now that will, you know, put us in a better position to make the right decision?
Yeah, well, I mean, everything that we started saying when I was there and the first talk of Medicaid expansion happened, what the Democrats were saying was rural hospitals are going to close.
Yeah.
300,000 are going to go without care, including 25,000 veterans. We were saying that if we do expand Medicaid, that's 15,000 jobs a year created for the next couple of years. And so everybody, you know, we're kind of pshawing that, you know. But 2 years later, a year and a half later, when Governor Haslam realizes that we've got to do something, and he came up with Insure Tennessee, I wanted Medicaid expansion, but I was happy to get on board and help push Insure Tennessee and make people understand what that meant. And it's funny that those folks kind of came around to our talking points. Hospitals are going to close, and it can create jobs, and that's exactly what the Democrats were saying from the very beginning is exactly what came true. Now we're the #1 state in the country with hospital closures.
Yeah.
Those are good jobs in rural areas. How do you replace a good paying hospital job? Hundreds of them in rural counties. That's hard, if not impossible, to do. Yeah. So it's a huge mistake economically and morally. And another point to be made is the opiate crisis.
Yes.
We have a crisis in Tennessee. It's, a lot of places, but in Tennessee, it's really, really bad. And then you look at Ohio, who their Republican governor opted to expand Medicaid. They just came out with a study last month. Of those participating in Medicaid expansion, which is a big majority of the folks who are formerly uninsured, 96% of them with opiate issues got treatment.
Wow.
Can you imagine in the state of Tennessee if 96% of those folks with opiate addiction or issues were able to get treatment because of Medicaid expansion? There's nothing we could do that would be that helpful when it comes to our opioid crisis.
Yeah, I mean, it's an astounding number.
It is. And then, something that we don't think about so much anymore because the drug issue is so important, smoking. 37% of those participating in Medicaid expansion quit smoking.
Wow.
And 70% fewer visits from uninsured folks to the ER. This is what we've tossed to the side. It won't cost our state a penny. The hospitals have agreed to take up what's not paid for by the federal government, which is our tax dollars going to the federal government. And we've got more than $5 million that we just let sit there instead of doing something about the opiate crisis in Tennessee. And it's a huge mistake.
Yeah.
We've wasted several years where we could have been doing this because for really political posturing. That's what it's about. Yeah. And we've got to put Tennesseans first and not Americans for Prosperity in these groups that tried to stop a Medicaid expansion. Yeah. We've got to put Tennessee families first.
Well, and just that, you said Tennessee families, when we think about the impact on more than just the individual, when you speak specifically about the opioid crisis or substance abuse generally, the impact not only on that individual, but on their families, on their children, on their loved ones, and the resources that the community has to put into supporting that family.
It's expensive.
It's really expensive. And so, by doing something as simple as bringing our tax dollars home, we can also save resources in other areas and not put such a strain on our social services, which also saves us money.
Exactly. And it's short-term thinking, and I think we need to think down the road. We've got to think long-term. And again, there's statistics, and I don't know the numbers for this, but good statistics on people getting back to work once they've gotten the health care they need. And I could say a perfect example for me was my cousin, who is a veteran, who was one of those uninsured veterans when he came home. And he was working a construction job and hurt his back. Didn't have insurance, so wasn't able to go to the doctor to get whatever treatment he needed. And he started buying pills on the street to take care of his pain. Became addicted, and he is no longer with us.
Oh, wow.
And he's a guy who would have gotten back to work, gotten things taken care of, and been a healthy, tax-paying, wonderful citizen. Yeah. And we let him down, and there's many of those. Yeah. Many of those folks.
And I would imagine that, being out, talking to constituents right now and talking to voters and folks in the community, that you're hearing similar stories about any range of issues, whether it's healthcare or education or the economy, that you're hearing every day how this is impacting folks' lives.
Right. I mean, that's what those doorstep conversations are about. And education, the fact that we're trying to privatize public education. And, we need to be looking at smaller class size and giving our teachers the pay that they deserve and the resources they need in that classroom. and not spending $30 million a year on testing that's not benefited our kids at all. Now, you know, it's funny, people are like, oh, well, you don't want tests. I'm a teacher. We invented tests. But what a teacher knows is, what am I testing for? What is the best test to give me the data that I need, and how's it going to benefit the child?
Right.
And that's what we should be looking at. But that's not what we're looking at. We're using tests to find out what kids are doing, to measure teachers, and to give schools a grade. That's ridiculous. There are a lot of formulas you can come up with to measure a teacher. You know, and a good one is to give a class a pre-test at the beginning of the year and a post-test at the end of the year. See that progression. That's a good measure. You know, we can do that. There are so many ways we could be playing smart instead of tossing money out the window every year to test where we get lied to. A dump truck drove over the cable line, or, you know, just the ridiculous things that they've told us and we found out were false. And so we've got no data to show for it, or the test didn't get graded, or the teacher evaluations didn't get evaluated. You know, it's a mess, and it's waste, and we've got to fix it.
And I know, you know, there are a plethora of issues impacting our state that we could talk all night about. And I know that you have a point of view and a perspective, and, you know, some ideas about solutions, I'm sure, for several of those issues. So are there going to be debates or forums between you and your opponent that would give constituents an opportunity to hear more about these issues and where you stand?
Well, that is my hope, because I think it's really critical. We talk about Tennessee being last in people voting and things like that. It's because people don't feel like they know the issues. And so I think they need the opportunity to hear the candidates together talking about, where are you? Here's where I am. What do you think about that? That's when you can decide. And unfortunately, a lot of times our opponents don't agree to do those forums. I've been invited to 4. One was the Fountain City Town Hall. That one's already happened. My opponent did not come. There's 3 more. League of Women Voters is doing one, SEED is doing one, and ACT is doing one. I told them all I would be there. I don't know if my opponents are going to show up. I talked to there's a libertarian in my race, and he said he would like to come. So, you know, I'm not sure if he was invited or what. I'm going to check on that. But, you know, I hope that my opponents show up so we can let constituents ask us questions. You know, we do the TV show like Channel 10 or Channel 6. But the reality is those questions are by the pundits or from the TV station, and it's like a 5-minute segment. You can get 1 or 2 things in. I think that the people should have a chance to offer up the questions that they have for folks. And I try to be incredibly accessible, because, you know, when somebody's applying for a job, you want somebody who's going to show up. And I can promise you I'm going to show up.
Excellent. Well, speaking of that availability and that accessibility, tell us a little bit about how folks can learn more about your candidacy and your campaign, and if they're interested in volunteering or supporting, how can they do that?
Well, we've got an office at 311 Morgan Street that's open from 10 in the morning till usually 7 or 8 at night, so they're welcome to come by there anytime. We're doing phone banking and canvassing, and you can go to my website at votegloriajohnson.com.
Awesome. Well, thank you so much, Gloria, and we'll be right back with DTV in just a moment.